Hello everybody, good morning. Welcome to Nurse Noted channel. The last video we speak about interpretation of EBG. At this video inshallah we will speak about how to draw EBG, how to take the EBG from the patient. Okay. At first we must know where we can draw EBG. From where we can draw EBG. We have most popular sites to draw EBG. 3 sites: radial pulse or radial artery, brachial artery, femoral artery. Okay, we have 3 artery we can draw EBG from this one. As we see in this picture, okay, this is the radial artery beside the thumb, this is the radial artery. Here brachial artery, and femoral artery, this is the one in the leg. There is something to do before. We must check or do before drawing EBG. The first thing to do before drawing EBG, we must prepare our equipment. You must prepare your equipment. What is the equipment you must prepare before you draw EBG? First, we need gloves, so you can't draw without wearing gloves, so you need to wear your gloves. Okay. Second thing is syringe. You must have syringe. This syringe must be heparinized. There is heparin inside this one, but don't let amount of heparin in the syringe, because this amount of heparin may change the result of EBG after that. Okay. Cotton, this is the third. After finishing drawing, you must do compression, so you will do compression with cotton. Okay. Fourth thing, blister. After finishing compression, you must put blister over the cotton to keep the artery closed. Okay. The second is explaining procedure. It's very important to explain the patient your procedure, what you will do. As we know, EBG is very painful procedure, so we need to explain to the patient what we will do. What is this EBG? From where I can draw this EBG? So the patient must know. Don't surprise the patient. Okay. First thing, and identify best site and consider contraindication. We must identify from where we will draw this EBG. So we need to check first the pulse. There is some patient, there is no pulse. There is some patient choked. So if we check here the radial pulse, we will not find pulse. Okay. So we need to check another site. So the second choice for us is femoral artery. It is more easy than brachial. Prefer not to use brachial. This artery preferred not to use. Okay. So the first choice for us is radial artery. The second choice is femoral artery. Okay. So what is the contraindication? There is some patient have shunt for dialysis, so we aren't allowed to put even cannula or draw labs or draw EBG from the side of the same arm of shunt. So this arm is contraindicated. We have another patient, females, like they do mastectomy, so it is not allowed to use the side of this mastectomy, even side right or left. So we not allowed to use the arm besides the side of mastectomy. Okay. So this is contraindication. The fourth thing is Allen's test. This is very important. We must know how to do this test. And at the arm, if we will draw the lab or we will draw the EBG from the radial pulse, we have 2 artery. Here ulnar artery. Here is radial artery. Those both artery push blood to the hand and supplies the hand with blood. So we must to check. Sometimes, or there is in some patient have problem in this ulnar, so this one not working. If we draw from radial artery, if anything or any complication happen to this radial, so the hand will not get blood. So from where can get blood? This one not working, and this one will have another complication, so the blood not supplied to the hand. So we have at this time we will have a problem in the hand. So we need to check it first before we do. What is this Allen's test? How we will do this test? Okay. For example, this is the hand of the patient. We need to let the patient close his hand like this. First his hand for 1 minute. Let the patient to close his hand like this for 1 minute. Then we use our both hand. One hand put here in the ulnar, close the ulnar. The another hand put here to close the radial pulse. Okay. We will try like this. I will close by this hand the ulnar. The another hand I will close the radial. Okay. Let the patient open his hand. See, this is white, there is no blood reach to the hand, so it is white. After 5 to 6 seconds we will release the hand on ulnar. Okay, so see, you check the hand become red, so blood, there is blood reach to the hand, so this one is working now, so we can remove. From 5 to 6 seconds you will find the hand red again, so both of artery is working good. Now خلاص, this finished the Allen's test. How we draw the ABG, this we know at the last of the video, at the end of the video. What we do after drawing ABG, okay, first thing, we must press or do pressure for at least 5 minutes, After we draw ABG, we compress the site of ABG. There is some patient we must compress more than 5 minutes, like the patient take Clexane, like the patient have increase in INR, like the patient have heparin infusion. So this patient have their INR is high, slightly high, so we need to compress more than 5 minutes until the blood stop, not to have any contraindication, if any complication, not to have any complication after drawing this ABG. Second thing is discard sharps. We have needles, we have anything sharp, we must discard after this procedure. Third thing, to evacuate the air. No need to keep the air in the syringe, because this air will change the result of ABG. First thing is sending the sample immediately, because maybe it will coagulate it, so we need to send immediately. If we will delay in sending the lab to any cause, so we need to put this syringe or this tube in ice bag. Thank you for watching. If you found this one interested, please don't forget to subscribe. If you need any subject or you need any special video, you write in comment what you want, what you need. Thank you.